of getting information out for the Triad and for the state of North Carolina and where we're at with COVID-19 here. I know last Thursday, just to recap a little bit, we had talked about where we would be seeing more cases of COVID-19 in North Carolina, and that wouldn't surprise me even in some areas if it was doubling. Two reasons for this. One is the number of cases is increasing, and two is that as we start testing more, we find more. So whenever you see and hear the numbers for COVID-19, you have to keep that in mind. One is more cases and then more testing, and the two to come together to increase the number. So how do we interpret the numbers that we have now? In the state now we have over 300 and some cases. You may be hearing two types of numbers for any one area. One of them comes from early on in the laboratory reporting scenario, and the second number of cases comes from cases that have been confirmed and vetted by public health authorities. So generally I use the numbers that have been confirmed and vetted by public health authorities. In the state, the number of cases that are increasing and the rate of increase, I think, is clearly highest in the Charlotte-Mecklenburg area. And this would make sense. It's our biggest city, and it's our city that has a lot of international businesses and travel in and out of it. And they've also been working real hard down there to try to identify cases. And in the state, that's the area where we're starting to see the biggest increase. Probably the second biggest increase would be in Wake County in Durham area, so the Triangle area. And now neither of those places are in what I would call the danger zone, and it's nowhere near the problems what we've had in Seattle, in Washington State, and in parts of California, including San Francisco, and by far not nearly what it's been like in New York City, which I think is the place that remains with the most cases and the most rapid rate of rise here in the United States. So that's kind of where we sit now. Now, specifically here for the Triad, we remain at 12 cases in Forsyth County, and just a tad more over that. I think it's 16 in Guilford. And so we're kind of lagging behind the rest of the state, which is okay for us here in the Triad, is to lag behind. We have had some admissions to the hospital since I talked to you last Thursday. Not here in the Triad. They've all, to the best of my knowledge, all been in Charlotte. But so far, no deaths here in North Carolina. And that certainly is good news. Last week we talked about how COVID-19 is like a hurricane a little bit, and we're trying to, by the way, this is not a good time to have allergies because everyone looks at you kind of funny, but it is tree season and the allergies out, and we can talk about that in a little bit more. So I was saying, it's a little bit like North Carolina is now in the early stages of a hurricane. And whether it be a Category 1 hurricane or a Category 5 hurricane is going to depend a little bit on what we do as a community and as a society to try to help prevent the spread. And what that is basically is social distancing and trying to stay away from people who are sick, and if you're sick yourself, trying to stay away from other people. I can tell you that while we don't technically have a shelter-in-place order here from the governor in North Carolina at this point, we are scaling back on some businesses, as you heard, the ones where there's a lot of close contact, beauty parlors and tattoo places, movie theaters, gyms, so on and so forth. And I agree with that 100%. I would also like to reach out to our citizens and the people here that really a shelter in place doesn't have to be an order. You don't have to be told to do that. And you can do it on your own. And some things to think about as you go about your daily life. First of all, no one is asking anyone to not do something that is essential. So you can go get your groceries, you can go get your medicine. If your puppy needs some dog food, by all means, go get it. And gas stations are still going to be open. Essential services to keep your home running will still be operating. Those are things that won't be cut back. The things to really think about are things that we really enjoy doing in a social sense. So neighborhood parties, big play groups of kids, getting together on the playground where there's lots of people congregated. These are all things to think about before you go out and do it. These are avoidable. They're not essential right now, and they can help reduce the spread of the virus in the community, because you don't know for sure who might have low-grade illness that you don't recognize. So I really would encourage everyone to kind of get a shelter-in-place mindset about doing things. And if there is a formal order and somebody telling you to do it, then it'll be a lot easier because you've already gotten your mind right about doing it and have made those changes. And if you don't hear the order, it is something that you can do that can help keep the category of our COVID-19 hurricane lower rather than higher. And so it's an appeal right now. Now's the time to start doing that. I think if we start now, we can make a difference. I really feel that the data's pretty good, and we know from other areas that it'll work. The second thing is there's been some big changes, just to put out, in our approach to evaluation and testing for people who have been ill. And this is both in local communities, medical centers, academic medical centers, and also from the state of North Carolina yesterday. The official guidance now from the state, and I think makes 100% sense to me, is that if you are sick with a fever and a cough, in other words, you have a flu-like illness, and you don't have severe symptoms, and we'll talk about what those are in a minute. If you don't have severe symptoms, there is absolutely no reason for you to get checked out by a doctor, go to a clinic, and you don't need to be tested. If you think about it, during the middle of flu season, right during the middle of flu season, and you think you have the flu, there's a pretty good chance if you have the flu, if you have a fever and a cough, that's probably what you have. We don't all go to the doctor. We stay home, at least we're supposed to, and we take care of ourselves. We do those things that Mom told us to do. Get some chicken soup, lay low, get some rest, drink lots of fluids, take your Tylenol or your Advil or your other product for fever reduction, and just get better. It's really no different for COVID-19. The vast majority of us aren't really going to get that ill. So how do you do this? You start to feel ill, fatigue, muscle aches, a little bit of headache, and then fever and cough. The fever and cough usually come on pretty early. Time to stay home. Wow, you get a ticket to stay home. You don't have to go to work. It's a good thing. Try to distance yourself some from the other family members in your house the best you can, and take some medicine to make you feel better. Drink lots of fluids. Make sure you get some good nutrition and get good rest. You should stay home for at least 7 days and then have 72 hours of symptom improvement without fever before you can go back to work or your daily activities outside. So during that time frame, should you be the one going to the grocery store? No, send somebody else. Send a friend to go get the groceries. Send your husband, send your wife, and they can go do those things. So you really need to stay home during that time frame. So to recap, if you have flu-like symptoms, it's okay. You don't need to get seen. You don't need to get tested. Stay home and take care of yourself. And for COVID-19, that's sound advice. Now, particularly if you're older, over the age of 65 or so, or you have underlying health problems, you might want to be paying close attention to your symptoms as time goes on. If you start to feel better and then your symptoms get worse again, if your fever goes up higher, if your fatigue becomes such a point you can't even get out of bed anymore, if you're starting to have trouble breathing, like going up the stairs, if somebody notices that you're just not right in the way you're talking and what you're doing, then you need to call your doctor, call ahead, and then get evaluated by a healthcare provider at that point. If you have severe symptoms, it's okay to call 911 and get picked up. Now, we don't want to be doing that for symptoms that aren't an emergency, but if you feel you really have an emergency because of your symptoms, you do need to get evaluated. That's nothing different than from what we normally do, right? If you have a bad case of the flu during flu season and you start to get worse, you'd call your doctor, you'd get checked out. Same thing for this. It really isn't anything different than what we usually do. The other thing is about testing. We don't really need to test everyone who has flu-like symptoms. In fact, right now it doesn't make much sense to test somebody unless there's a difference in your care or the care of the people taking care of you in a hospital situation. So where do we want to be testing right now? And this is from the state. We want to be testing people who are getting admitted to the hospital, because we need to do special things in the hospital in order to segregate our patients who have COVID-19 and who don't. We don't want them together. And the second reason why is because when you're being admitted to the hospital, having a diagnosis is good. We really want to know what it is exactly that you have so that we can tailor treatments. And even some of the treatments for COVID-19 that you might have been hearing about, we would like to do as part of a study. So we would like to be testing people for that. The other reason, the other group of people we like to test is healthcare workers, and that's because it helps us get our healthcare workers back to work if we know what they have. And then the last group would be people who might have underlying severe illnesses, immunocompromised people, people who have had organ transplants and such, who get influenza-like illness. Those are people that we still might want to test. But everyone else, and that's about 85% of the country, we don't need to be testing that anymore. If you have a flu-like illness, then you have a flu-like illness. Could be the flu, could be COVID-19. And for your own personal care, if you're staying home, and you don't have a severe illness, it doesn't really matter. And that's the latest information from the state. So with that, I think I would like to just go ahead and open it up for questions.
Can you talk about the allergies versus what's symptoms, what's allergies?
Right.
My husband asked me, he's like, I don't know if it's allergies, I don't know if it's...
Well, your husband and I have something in common. So, so yeah, it is allergy season. Boy, look outside, the trees are starting to come out and the grass is up. So allergies tend to be more problems with the nose and the real upper part of your body, above the neck. So there sometimes is a little bit of cough with it, particularly if you have asthma. But the one thing you don't have with allergies is fever. And you also don't have that really bad flu-like ache, tiredness, fatigue, muscle achiness, headache with allergies. That's more COVID-19 or flu or one of a number of other viruses. So if you have allergy symptoms, treat your allergies. And it's pretty easy for us to sort out in healthcare, and I think it's pretty easy for people who have allergies to sort it out too, because they know what it's like every year. But fever is the big difference.
On top of just staying at home and trying to keep yourself distanced, I think that there was a release that came out the other day that also said that Wake Forest Baptist is converting clinics into temporary respiratory systems.
Yeah, well, so we do have a couple of clinics open now where you can be evaluated for respiratory illness. And the reason for doing this is it's a lot easier to have efficiency in one place where you have people doing it. But I do want to emphasize is that these are clinics mostly for people who have underlying health problems and then might get an influenza-like illness, fever and cough, in order to be checked out and evaluated. But it doesn't mean that if you're otherwise healthy and you're doing fine, other than just being sick, you don't really need to be seen. We'd like to reserve it for the people who have underlying health conditions or other problems, so that we can sort out who might be ill enough to maybe have special other things or other medicines or other evaluations. Not everything is COVID-19 with a fever and a cough. So that's the main purpose for those clinics. I think for the most part, you probably won't get tested if you go to those clinics unless you're going to be admitted to the hospital. Because if you're going home, according to the state and almost everyone now in public health and medicine, if you're going home with it, you don't need to be tested.
Those two facilities that were converted, talk a little bit about them. Why did y'all decide to do that? And how is that going to really help?
Well, why did we decide to do it is mostly for convenience of scale, convenience to the patients, and also to keep visitor traffic on our main campus down some, and people traffic down on our main campus. I mean, because our main campus has a cancer center and more immunocompromised patients and such. So it's a little bit for a convenience for the public, and also to get that off of the main site for us. It's just going to be easier for people, easier for the healthcare providers to do it that way. And then and when you think about it, it's kind of an efficiency model of providing care and using the personal protective equipment. If you have it centralized, which we call PPE, that's the gowns, the gloves, and the masks. It's easier to do it if you're doing it all in one place where the need might be. So it's kind of like having a specialty store, and rather than a large general store.
Will they be, what are the hours? They have special hours, or?
I actually don't know that right now. Maybe our media people can help you with that. I'm sorry, I just don't remember them off the top of my head, and I'd hate to tell you something wrong. But our COVID hotline would have that, and our external website also has that information, and people can get those hours there. But I believe they are 7 days a week. There's some place to go.
Have you changed your opinion on how long you think all of this will last?
Have I changed my opinion about how long this will last? Well, I have to qualify that, in that my opinion has been very broad, and I've always said I'm not so sure exactly, because I don't have a crystal ball. If you look at other countries who are going through this or have gone through it, it's roughly about 12 weeks. Here in the U.S. it may be a little bit different because we're a little bit later coming on, and the sharp rise of cases like we saw in Italy and other places in Europe, other than in New York, hasn't really been the case here. So we might have, quote, flattened the curves in some of these places, in the U.S., and in which it might last longer but be less severe. These are all postulates, which is a fancy word that doctors use for guess. But in the long run, I mean, the virus will be around for a very long time. And we will get used to living with it, just like we get used to living with other viruses that come along. And I said last week, the big example of this was swine flu, remember? 2009, that was a pandemic. We all went through it. Hardly anyone remembers it. And that virus, the 2009 H1N1 influenza virus, we still have every year. And we've learned to live with it. I think that and we talked about this some last week. What's really being debated in the big scale of things right now, amongst our public health leaders and scientists, is what's the best exit strategy? Because we can't do social distancing with full shelter in place forever. So what's the strategy? And there's several ones out there kind of that people are talking about doing, and time will tell, but people are starting to think about that. The ultimate exit strategy is going to be a vaccine. And every week we have this briefing, we're 1 week closer, but it's still quite a ways off, probably about a year or so.
There was supposedly a memo sent out internally to staff about needing to potentially reuse and sanitize masks if they get too low. Is that something you can comment on?
Yes, I can tell you that memo generated a lot of discussion. So, a little bit of background, as people know, the masks, the gowns, and the gloves, but particularly the masks, are a shortage nationwide. It's nothing new or different here in the Triad. In fact, in some aspects, we're a little bit better off than other parts of the country. I think right now New York has probably got the biggest troubles with that. So there have been some academic medical centers that have looked at using science and new approaches with the masks we have. So it turns out that you can use ultraviolet light to sterilize masks and then reuse them. The science is sound, and it may be a strategy we could use if we needed to. So right now we don't need to. We're not reusing masks. In fact, I don't really know of any place, except maybe a hospital here and there that are really strapped in the U.S., and it's not around here, who are reusing masks. But think about it. If all of a sudden you were told that there are going to be no more Ziploc bags, and you're going to have a Ziploc bag shortage, would you throw away every Ziploc bag you just used? Probably not. You would stick them in a drawer and keep them in case you needed them. And so it really didn't make sense for us to be throwing away masks that maybe in the future we might need to sterilize and use. Personally, do I think we'll ever come down to that? I really doubt it. But why throw away something that you could sterilize and reuse if you had to? So if you ever hear about a Ziploc bag shortage, you'd probably throw them in, at least I would. I'd put them in a drawer and think about how to reuse them if I had to. Same thing. So.
So I just got this question of Memorial Day weekend is 2 months away. Wondering about the safety of swimming pools. Do we know anything?
Memorial Day weekend, man, doesn't that sound good? Swimming pools, yeah.
Chlorine kill it? Or
Chlorine does kill it. So I've looked at this for some of our indoor pools before the gyms were asked to close, a while back. So there's really no data that swimming pools right now are a risk or a problem. I think we'll be looking at that more towards as the season gets warmer. Some reasons why people wonder about that goes way back to the older people in the crowd. with polio. And remember, well, I don't remember, but some people might remember when polio was going around in the late 50s and early 60s. And in those days we did close swimming pools, but that virus transmitted very differently. It was what we call an enteric virus, a gut virus, something that you get from your intestinal tract. And swimming pools sometimes can be a problem with those viruses. So, but this one's not really like that, at least what we know now in its transmission. So more to come on swimming pools, but right now there's no info that says they're going to be a problem. However, swimming pools, at least the public ones, are a place where a lot of people get together in close proximity, and so for that reason, it may not be a good idea.
We were talking about earlier about the shelter in place, about people, it's easy that you don't have to be told to shelter in place and stuff, but there was a report come out that all the state hospitals have asked the governor to issue a shelter in place. Do you agree with that, and has things gotten that bad here in North Carolina?
So the question is about a shelter in place, and then I said that you don't need somebody to tell you to shelter in place. You can do it on your own for your own protection and for the protection of everyone around you. And again, the shelter in place, while it seems like it's really painful sometimes, is to protect our vulnerable people and to keep our hospitals from getting overwhelmed. Those are the main reasons. So the latter, keeping our hospitals from being overwhelmed, obviously the hospitals have a little bit of a stake in this, and sure, they're going to tell the governor that's what they would recommend. What do I agree with? I think right now that it's silly to be doing a halfway shelter in place. If you're going to do it, do it. I mean, if you're going to go to college, study. If you're going to, be an athlete, work hard. It's the same thing for shelter in place. If we're going to do it, let's do it. And so I would like to see people doing it. There's a lot of other stakeholders in the room, and the governor has to weigh economics as well. But I know from a fact, from being part of these discussions with the state, that the governor really does he really does want to look out for our safety and the health of North Carolina. And I think that if he deems it that that's what has to be done as an actual order, he will do so. But if we're all doing it on our own, maybe we won't need to be ordered to do so. It's kind of like if the kids wash the dishes on their own, Mom doesn't have to say, wash your dishes or you don't get your allowance. Is that a good analogy? I don't know. Any questions from over on this side? So just a little bit what to expect in the future. So I think we will still have more cases in North Carolina. Like I said, the sharpest raise of increase now in cases in the Charlotte area, which isn't surprising. It's our biggest city. But I haven't seen anything yet that makes me say, whoa, this is really going to be bad. I haven't seen that yet. The next week we'll have more information. I'll be back here again on Thursday to update on things in the interval. Hopefully it'll be a quiet 2 or 3 days and we won't have much to talk about.
Another thing I was thinking about, I can't remember, I haven't seen the latest thing, but I think North Carolina still hasn't reported a death yet.
No, the best of my knowledge, we have not had a death in North Carolina.
That's a pretty good surprise according to what you see going on in other areas.
Yes, well, some of the other areas had special problems that created more deaths for them. Seattle in particular, where it was in the nursing homes. And patients in nursing homes who are really at the oldest of the old, kind of the extreme of age, or have a lot of underlying health problems, are the most vulnerable. and they're the ones who are going to have statistically have the highest risk of dying. So New York, it's probably just the sheer volume of the number of cases they've had as compared to here. And that brings up a point that I want to talk about is with nursing homes. Right now in the state, I'm not aware of any outbreaks in nursing homes in North Carolina. But this is a time where a lot of nursing homes have restricted visitors and have very strict rules for monitoring their staff and their employees coming in and out. And we really have to respect that and adhere to that because we really want to protect that population. And if you are in a nursing home or a staff in a nursing home and your nursing home hasn't yet put those in place, it's time to get that together and talk with your leadership. And reach out to your county health departments for help with that if you need it. As Forrest Gump said, that's all I have to say about that.